right, let's start with the big story this evening. Now, we've been talking from some days about whether the worst is over. And the fact is that whether a CEO poll feels positive or whether high frequency indicators show that green shoots may be around the corner, the true test is when the COVID numbers start coming under control and when we finally have a vaccine. Now, a vaccine, as we all know, may take some time. But what's happening with the COVID numbers? And that's very crucial. The health ministry is claiming that there has been a huge improvement in the number of daily cases. And if you take a look at the daily cases, they have been coming down. Remember, in early September, we had daily new positive cases of close to a lakh a day. Now we are down to about 61,000 odd in the last 24 hours, and we've been hovering around that mark. Does that mean that we have turned the corner? How safe can we be at this point? We have Dr. Velumani with us, and we'll be speaking with Dr. Hemant Thacker in just a bit. But let me go across to Dr. Velumani first to get a sense of the numbers. Dr. Velumani, I know you track the numbers very, very closely, which is why I was keen to get your view on, the positive sort of spin that we are seeing right now. You've always said that the key number is the deaths. Looking at the deaths that we are seeing and the new positive cases, could we say that we are beginning to get the virus under control?
I don't think virus comes under control anytime. In fact, our fight corona is a wrong terminology. How can you fight a virus? It's not an animal, it's not a beast. So having said that, whatever measures we have taken, one can call that as reasons why we have less death per million. But as I have been telling for the last 6 months, India is blessed. You are noticing only 100,000 dead. Sorry for using that word only, because such a huge country of 1.38 billion population, 1 lakh is a small number compared to the Western counterparts. But to come to specific to your question, we are aware of numbers. I am specifically aware of numbers, but these numbers are what is reported in ICMR portal, be it PCR test or rapid antigen test. But incidentally, if you notice it, people have become less worried. I know plenty of families where they had symptoms. One man got tested. All had symptoms, all didn't go for testing, and all of them remained quarantined, and their family was positive. Then after 10 days, they tested all of them positive for antibodies. So what is happening? These numbers are not getting on ICMR portal. So what comes there is also very often filtered. In my personal opinion, only antibody levels, only herd immunity can control virus till vaccine is around. I have observed a percentage of roughly 38%.
Yeah.
38% of the population have antibody,
yes.
Which means... Go ahead.
I will come to the antibodies part. Dr. Velumani. But let me ask you about a very important thing, because we've been tracking the numbers consistently, and when we were close to the 1 lakh a day mark, it was extremely worrying. So when we're closer to the 61,000 a day mark, we should take note of it and understand what is happening. Now, one theory or one question that has been put forward is that a lot of the tests we are taking, and we don't know how many for sure, are antigen tests and not RT-PCR. The antigen tests give quicker results and are cheaper, but could have more false negatives. What are you seeing in your view? Because a lot of testing data is what you look at as well. What proportion is antigen tests, and could these be leading to false negatives and us underestimating the new cases?
You are absolutely right. 2 months back, 100% was RT-PCR. Today, 70% is rapid antigen test. So we have changed the technology. So the goalpost itself is changed. Coming to specific to your question, you got it exactly right. If we do 1,000 people RT-PCR, we will get roughly around 20% positive. When we do rapid antigen test, only 7 or 8% positive. Where is this 13% going? They are undetected because rapid antigen test doesn't have that much sensitivity to declare that as positive. That doesn't mean we have controlled virus.
Absolutely. Dr. Thacker has joined us now, Dr. Hemant Thacker. Great to have you on the India Development Debate this evening, Dr. Thacker. What is your view on the numbers? Because people are waiting for positive news, and everyone knows that a vaccine will take time. Herd immunity in its full blown, sort of avatar will mean a lot of people who have passed away. But seeing the new daily cases reducing, and the government says that's a hugely positive sign. Would you concur? Is that a hugely positive sign?
See, the virus is like a tsunami, a tidal wave. When it came, the height of the wave was very tall. We had lots of numbers. And now, as the wave is slowly coming down, I mean the tsunami wave, the water is still flooding. The water is still moving, but the height of the water is less. So if the numbers are less, which they probably are, they are for two reasons. Today, there is a social cause and a medical cause for the slip between the RT-PCR and the rapid antigen test. A lot of people, to dodge the civic authorities, are doing rapid antigen and CT scans, where they do not need to inform the authorities. And a lot of people are not doing the RT-PCR. Having said that, I agree with Dr. Velumani that there is a level of false negative which you see in the rapid antigen test. So this rapid antigen test, we say the moment you get a negative test, you must convert it to an RT-PCR if the patient allows. Now, if the numbers are going down, there is also another reason for it, besides this social cause. And that reason is the virus is losing or waning in its virulence. We have better drugs. Remdesivir is working very well. We are now realizing that early treatment is important. We are also seeing that the virus cannot propagate if it goes into a person who has already been infected, whether symptomatically or asymptomatic. So if you have 5 people, and out of 5, if one of them is infected and the virus jumps into that patient, the virus dies. The virus cannot multiply because he has the antibodies and he doesn't do his purpose. So that the virus abates in its virulence. And the point that Dr. Velumani made about herd immunity is correct. So much for the different talks about reinfection and mutation of the virus. Of course, we are seeing esoteric cases where 4 doctors in Bombay and a few others were detected to have a reinfection. But if you have the COVID-19 family infection there, then all you need to do is continue your civic measures. And you will find that even if you get a mutated infection, it's going to be less virulent. It's not going to take your life away. And it's not even going to make you go to hospital. So numbers are coming down. The only thing that people need to remember, don't take it as a false sense of security. The vaccine is far away. Your mask is in your pocket. It should be on your mouth and your nose. The sanitizer, it's not in your bathroom. It should be on your person. And distancing is the most important. You have to remember 3 feet between the person in front of you and behind you. If you do that and you let 2020 go away peacefully, yes, we all look forward to a happy new year where the vaccine comes closer. So the numbers are going down, the virulence is less. We need to polish the slip between the false negative rapid antigen and then the RT-PCR. We learn now that Reliance is also coming out with a quicker RT-PCR strip test. So if we get that test, we will again get more numbers to see. So this is a mix of social causes, medical causes, but it's a mood to look forward to, I think.
Okay, Dr. Thacker, there strikes an optimistic note saying that the virulence has gone down, and that's an important one. But Dr. Velumani, just give me a sense of how much testing is taking place. Now, India's testing numbers have improved. Testing protocols have also become easier. Tests are more widely available, though the costs are still higher than most people can afford. Is that impacting those that are taking tests?
No, actually, in this last 6 months, just in 180 days, the cost of testing has come down from 4,500 to 1,200 rupees. I think in another 3 months period, it can even touch 800-900, but it can't go less than that. So today, cost is not a problem. Of course, for a common man, it's still a problem, but above the middle of the pyramid, it is still affordable. Capacities are adequate. All laboratories have enough capacity. For example, we have 15,000 capacity and we don't have even a 4,000 load. Rapid antigen test has come in. We believe because of that, the RT-PCR loads have come down. But to be very honest, nothing is known as a right number because of the fear, panic of the public. And the governments all governments, sorry to say, no government is willing to talk truth. Everybody wants the number underreported so that they can open up a little faster, so that their economy can get back to normalcy. But according to me, the entire 1.38 billion population will have to go through if the vaccine doesn't come. Even if the vaccine comes, this virus is not going to spare anyone. In my personal opinion, since 40% plus are already antibody positive, like how Dr. Thacker said, the virulence is less, not because its DNA has changed. It is unable to create an infection in all it exposes. That means the numbers should come down. But if you see, the number of infected is shown coming down, not the number of deaths. Number of deaths are still hovering around 1,000 for the last 10 days. And this number of deaths will play a very important role and assurance that the virus is moving back. Not the number of infected cases. That will vary from state to state. That will vary from budget to budget, testing to testing. Let me tell you, more you test, more will be positive. Less you test, less will be positive. In my personal opinion, the number of infected less only because of rapid antigen test usage, but the number of deaths have not been showing anything downward. But the happy news is it is stagnated at 1,000, and that itself should be celebrated.
Yeah, at least it's not going up. But early days to start celebrating completely yet. And we also have to be careful because we're going into festive season, we're going into colder season, some parts of the country which can cause more respiratory diseases. So cannot afford to take our eye off the ball. Thank you so much, Dr. Velumani and Dr. Thacker, for joining us for this very important section of the show where we're focusing on what's happening with COVID-19.